Ahead on America This Week, United We Stand.
We will now have that imprinted on us forever.
Dr. Anthony Fauci offers his vision for our post-COVID-19 nation. Plus, coping with the pandemic, I talk about the mental impacts with psychologist Dr. Shreya Hessler. Our expert panel answers your questions and concerns about the virus, and a homecoming for a coronavirus survivor that will tug on your heartstrings.
Daddy!
It's pure joy, it really is.
Right now on America This Week, United We Stand. Welcome to America This Week, United We Stand. I'm Eric Bolling, hosting from St. Michael's, the oldest church in Charleston, South Carolina. Each week, as the battle rages against the spread of the coronavirus, we'll bring you this new half-hour show because we're all in this together. And we'll continue to bring you the most up-to-date information, developments, and experts to answer your questions and your concerns about COVID-19. This week, I had the opportunity to speak one-on-one with Dr. Anthony Fauci, one of the world's leading experts in this epidemic. I asked him about what the nation returning to normal would look like and getting back to our favorite national pastime, baseball. Take a listen. Give us a sense of what post-COVID-19 normal looks like for America, in your opinion.
Well, I didn't want my words to be taken out of context. When I said we'll never really get back to normal, I didn't mean that all of a sudden we're going to be abnormal forever. I meant that our sensitivity to the need to be prepared for these kinds of unexpected, catastrophic global outbreaks, we will now have that imprinted on us forever. And I think care that people take in addressing how one responds to emerging infectious diseases is different. That's what I mean when I said we'll never get back to the same. Getting back to some degree of normality, that will come. We will get over this. It may not just be in the next month or two, because we have to be concerned and prepared for the possibility that it might cycle. It might come back next season if we get it under control, which I think we will get it under control within the next several weeks to a month or so. But we need to make sure we're prepared.
I have about a minute or so, and I just want you to give us a little bit of sense. I mean, will there be, and granted, you're not a politician, you're not an economist, you're a virologist. When would it be smart for us to go back to, let's say, a baseball stadium sitting next to someone very close to me?
You know, it's tough to predict, but the guidelines are extended for 30 days till the end of April. We will have a considerably amount more information by then as to whether that curve has gone steeply down. As it does, we'll have a graded, progressive return to some form of normality. Whether that will include ballparks where people are sitting next to each other is difficult to say right now. But I think we'll gradually phase into that. There are different ways of doing that. You could have ball games in which you don't fill up a complete stadium and you keep a certain distance. I'm sure that the directors of the Major League Baseball associations are probably considering that right now.
The coronavirus pandemic has definitely had a huge impact when it comes to mental health for some people. Joining me now is Dr. Shreya Hessler, a licensed psychologist and the founder and director of the Mindset Center. Doctor, thank you for joining us. A lot of people are asking a lot of questions. You know, how are we dealing with this? What's the best advice to you? I mean, we're hearing stories of domestic violence spiking, of even child violence against children, because they're staying home from school. Give us one sound piece of advice from your perspective.
So it's really important to think about what is within our control to do. So I've been telling my patients in a variety of ways, take a look at what is in your control to do, and take a look at how you can try to keep yourself on a routine, on a schedule, and take the things that you know are within your power to do on a daily basis, like self-care, and access to your schedule, and making sure that you get up in the morning and take care of your activities of daily living. Those are the things that are within our control and the most important things to focus on every day when we get up.
No doubt. Let's be useful here for a second. So let's say our audience, people are watching and they're getting frustrated. They're experiencing a lot of anxiety and they're cooped up with another family member or more. What do you recommend these people to do? I mean, should they get up, get out of the house and go away before something bad happens?
Sure. So I think that it's difficult to manage sometimes challenges within a family household and family dynamics. I think it's good to get space when you can get space if your home allows for you to do so. Obviously, we want to follow what the CDC guidelines are in terms of how much you can go outside or communicate with people that you do trust, whether that's via telephone or other forms of social media. Those are ways of us communicating with people when we're feeling like we need more space from those that we're living with.
You know, and I understand that, and there are a lot of assistance available, phone lines and whatnot, internet.
Yeah.
Go on the internet and find some areas for help. But I'm being more acute here, because we all know about those, and we post them on our show. These phone numbers for if you're experiencing domestic abuse, et cetera, or addictions, and maybe you want to start drinking. I mean, this has to be a big problem. Are people starting to drink more? I mean, there's anecdotal evidence of that. You see pictures on the internet of garbage cans being filled with empty alcohol bottles. What do you tell these people who may be recovering alcoholics and drug addicts?
So I think it's important that for folks that are in recovery to reach out to the organizations that they have been accessing. The American Psychological Association and the Anxiety and Depression Association of America do have links so that you can, if you're suffering from potentially relapsing or needing some extra support, those lifelines are there and available. And through the formats of phone and other methods of technology, we can, I know for a fact that some of my patients are able to access AA groups and NA groups virtually, and that has been a tremendous lifeline for folks that are needing that extra support right now.
You know, your group is called Mindset Center. Let's talk a little bit about that. Let's say people who are feeling the anxiety, feeling cooped up, feeling stressed in this time. Give people just one exercise that they can do to kind of at least let some of that, you know, some of the steam out of the pot right now, just to relax a little bit. What do you suggest people do?
That's a great question. You know, in my practice, what I specialize in is anxiety disorders. And so we are in this world of uncertainty right now. And so the most important thing we can do is take pause. I know I do this every day. There are lots of different strategies I can teach folks, even to your audience right now. Just taking a couple of deep breaths, finding a quiet space where we can count to 10 or 20, breathe through our diaphragm, and take a nice deep inhale. One strategy I teach my pediatric patients and my adult patients alike is how we can kind of slow our breathing down when we're anxious. We tend to breathe faster. Our somatic symptoms tend to increase and amplify. But if we can find a way to just kind of sit in a chair or sit on our bed or lay on our bed, close our eyes, and maybe even breathe deeply for a count of 10, inhale through the nose really slowly, and then exhale through the mouth. Usually I say inhale flowers or something aromatic for a count of 4 and exhale for a count of 6, and let the diaphragm kind of go along with that breath. What that does is that grounds us, and grounding techniques can be really helpful in resetting our mindset and helping us to be connected with where we are in our moment.
Dr. Hessler, I think that is of the most important information that we could have imparted to our audience right there. There are a lot of accesses that we can, like I said, there are a lot of places we can access over the phone or on the internet, but if people are feeling stressed, sometimes it comes up fast and it's acute and they need a minute, and that is just some great advice. We really appreciate your time. Dr. Hessler, thank you again, the Mindset Center. Ahead on America This Week, United We Stand, our panel of doctors will answer your questions that have come in from all across the country.
Everyone stands American strong. United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand America strong.
United we stand.
We stand America
United
strong.
we stand.
I'm here hosting America This Week, United We Stand from beautiful St. Michael's Church, downtown Charleston, the oldest church in Charleston, South Carolina. Dr. Dave Campbell, Chief Medical Correspondent, MSNBC's Morning Joe, and pandemic expert Dr. Dina Grayson joined me this week to answer your questions about the virus. Here's what they had to say. Guys, let's start with this viewer who called in to our line. Listen.
Can the animals that we eat, cows and such and whatnot, chickens and whatnot, can they get the virus? That's what I'd like to know.
So what about it, Dave? What about our food supply? What about the animals that we eat? Are we at risk to catching the virus through them?
You know, we're really exceedingly low risk. No, there's been no food transmission found so far. But take that into consideration that a tiger in the Bronx Zoo and some dogs have now found to have this. And if you go back to China, remember the wet markets in China had animals that were carriers of this virus. So the answer is no, but be a little thoughtful.
You know, Dr. Dina, Dave brings up a good point. We know it can be transmissible from animal to human. That's how we got it, allegedly, according to China. So does it have to be a live animal?
Well, it's not thought to be transmitted via the oral route, meaning if you eat meat, you're very unlikely going to get this virus. But I think what my colleague was referring to is actually having household pets, for example, that your pets are actually really more at risk from getting the virus from you, just like that tiger at the zoo got it from presumably what's believed to be from a zookeeper. So, you know, if you think you have the virus, don't rub your face in your pet's fur because you could actually infect your pet. But pets and animals are not thought to be an important vector for spreading the virus.
Right. Let's stay with you, Dr. Dina. Proud American 39 asks about the recovery time. So, let me expand this, if I may, Proud American 39. So you've had coronavirus, you've gotten the all clear. Let's say you're a healthcare worker. Are you safe to go back to work taking care of patients?
Well, CDC has guidelines on this, and if you are being tested for coronavirus, you need to have no fever, and also you need to have 2 consecutive negative COVID-19 tests over a 24-hour period. For those that actually cannot be tested, currently CDC is recommending 3 days without fever and at least 7 days since first onset of symptoms. But I would caution that actually may be too rapid because we've certainly seen cases abroad, including recently in South Korea, of reactivation of virus in over 50 people who tested negative after a 14-day quarantine and then subsequently tested positive.
Right. Dave, what do you say?
No, I say exactly the same thing. I've thought that the CDC guidelines were a little lax for those going back into public, and now we see some information suggesting that caution, an abundance of caution when you go back into the community or around family members after having been sick. But still, go back to the CDC guidelines and follow them, but expand it a bit.
Dave, let's stay with you. AC Brush asks, basically, let me summarize, how long are we contagious? Can you give us the window of contagiousness or transmissibility if you're a COVID-19 test positive?
Yeah. That really depends on how long you are sick. The duration of illness varies quite widely, and the determination of whether you are still contagious is dependent upon whether you're still shedding virus that can be transmitted to somebody else. The exact duration isn't known, but it can be several weeks, if not longer, since you have had no fever, since you felt fine. So again, drag that out as long as you can with the assumption that you may still be contagious longer than you would have thought.
Dr. Grayson, this is an interesting question that Tony Go asked, and I'm wondering about this. You know, a lot of people are concerned about Boris Johnson, whether he's intubated or not, whether he's on oxygen or not. Can you give us a sense of survivability, whether after? In other words, if you're sick enough to need oxygen, what is the survivability of COVID-19 after that?
We know statistics of those that go into intensive care, whether they're intubated, meaning put on a ventilator or not. About 2/3 of patients that are in intensive care with this virus do go on a ventilator. Now, Prime Minister is not thought to be on a ventilator, but even all comers into the ICU with this virus at his age, the overall mortality rate is about 50%, unfortunately.
So, Dave, 50% of people are requiring intubation, meaning they need to be assisted breathing, likely will not, or at least the data shows will not survive.
Well, that is
That's
correct,
actually
but remember,
that's actually 50% of all people that go in the ICU, regardless of being ventilated, by the way.
Right. Okay.
That's right. Thank
Okay.
you,
So
Dean.
another 50. So basically, you have 25% number. 50% of 50% means the mortality is about 25% if you need to be intubated. Am I doing the math right, Dave?
No.
well, it could be more. What I would suggest is that we all recognize that it is the sickest of the sick that are ventilated in the ICU, and those are the ones that will go on to develop the complications from the disease, whether it's pulmonary complications, cardiac complications, or problems with your kidneys.
Dina, you wanted to make one final thought?
Yeah, just to be clear, the mortality of 50% is for everybody who goes into the ICU, regardless of whether or not they're put on a ventilator or not. Those that that are in the
Wow.
ICU, about 2/3 go on a ventilator. So actually, it's very concerning for the Prime Minister because just the fact that he's in the ICU is very alarming.
That actually raises my number as well. If 50% of people who go into the ICU will not survive, and then that number, 2/3 of that are intubated that go into the ICU, it's higher. In other words, it's higher than a 25% number. Dina, Dr. Dina Grayson, and also Dr. Dave Campbell, we appreciate your time, and we will have you guys back. There are so many of your questions. People are just really, really want to know your answers. Thank you very much, guys.
United we stand.
Coming up next, one of the best medical reporters in the business, Liz Bonus, is here to answer more of your questions. Stick around.
Stands American strong. United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand American strong.
United we stand.
We stand American strong.
City by city, state by state, town by town, stand American great. Everyone stands American strong. When strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand American strong.
United we
We
stand.
stand American strong.
United we stand.
America This Week America's fastest growing political show. Points out how rough and tumble politics shape opinion in every region in our country. We tell American stories, stories that touch our people, determine our politics, focus on the future of America.
I'm Eric Bolling. Join me for a fascinating look at America this week.
They're recommending that people wear cloth face coverings in public settings where social distancing measures can be difficult to maintain, such as grocery stores and pharmacies. Remember, this does not replace the importance of social distancing.
Well, that was First Lady Melania Trump delivering her message via Twitter. We're joined now. Liz Bonus is the health anchor and medical reporter for Sinclair Station WKRC in Cincinnati. She joins us now to answer your questions about the coronavirus. Liz, I want to jump right into this. Thank you for joining us, by the way. Tom Smith called into one of our phone lines. He's a concern that I've heard quite a bit. Take a listen.
It's Tom Smith, Emmett, Idaho. And my comment is with the coronavirus, they haven't addressed this yet, but it's mosquitoes, a possibility of transmission there.
So, Liz, what about that? Very good question. Can mosquitoes transmit coronavirus?
You know, we don't have information now that they can. Remember that even when we looked at something such as HIV, there was a very small ability for the amount that you would need to get into the bloodstream. Now, the question is whether or not them just landing on somebody, and we know that this lives on surfaces, and they land on you, if that would make a difference. As of right now, I have not heard that from anyone, although I do have to tell you we're discovering new things every day, so maybe an answer for that will be in a week or two, and if I'm wrong, I'll come back and tell you about it.
And here's another one, Liz. Take a listen to James. He also called into the line. Listen.
James Casanova. I was just wondering if the dollar bills and the money is infected also.
So, Liz, can U.S. currency host the virus?
So, excellent question. Yeah, excellent question. And we actually have been asked this a number of times in handling anything. And so we do know that this virus can live on a surface. So if somebody immediately maybe touched their mouth, touched money and handed it to you, you might be able to touch that surface on money, but it doesn't live well on surfaces that are not live. So in other words, probably if your money's been in your purse for a while, it's not there. And hopefully you still have some given this economic impact.
Good point. I tell you, I've never been happier. I've had Apple Pay than the last 3 months than I am right now, because everything, if I can swipe it with Apple Pay, I don't even have to touch a credit card. I'm all over that. Liz, take a look at what Linda wrote in, and this is interesting. She talks about you know, if we can't get hand sanitizers and other products, rubbing alcohol, are there other ways, things like essential oils, that we can kind of DIY it, do it yourself at home to create some sort of sterile environment? Your thoughts?
So what's very interesting about that is soap and water is actually the best thing to sort of clear this up. I do know several people who work with essential oils, and they do have what they call disinfecting scents. But because this is a COVID-19 coronavirus, we can't actually say that it's been tested on this one. The scents in the air, certainly things like the lemon and whatnot, are not going to be harmful, necessarily not going to kill. We do know that if you look on the back of some of the, you know, traditionally bought products such as Clorox, it will say kills coronavirus. If you want to make your own, they say right now you need 60% alcohol. And we've had a number of breweries making them. I have to tell you, they work. But if you get stopped, like while you're driving and some of that stuff is on your hands, you are going to be in big trouble.
Yeah, they might do a breathalyzer. Liz Bonus, WKRP in Cincinnati, we thank you for your time. Thank you. Straight ahead, the emotional homecoming for a survivor of the coronavirus. It's an uplifting story that's bound to bring tears to your eyes.
Everyone stands, American strong, strength. United we stand, we never fall. this perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand America.
United we stand.
We stand America.
United we stand.
There was nothing but overwhelming relief for a Northern Virginia woman whose husband recovered from the coronavirus. He was recently released from the hospital after being in a medically induced coma. Victoria Sanchez with Sinclair station WJLA was there for the emotional reunion.
Some last-minute touches before the 21-mile drive Amanda Pomachan's been dreaming of since March 11th.
It's been 23 days.
She last saw her husband fighting for his life in Inova Fairfax Hospital's ICU. Today's the day 44-year-old Titu goes home. The wait is overwhelming, but worth it. The husband of 13 years and father of 3 recovered from COVID-19.
Oh my gosh, you ready to go home? The girls are ready.
Let's go.
Okay.
At last, he's home.
It's pure joy. It really is.
Titu's lost weight and is weak.
The whole thing was a blur. It's like it's like living a nightmare.
But he survived and wants the world to know.
When I woke up, the only thing I saw was bad news. It was 5,000 people got this and 5,000 people died. So I'm glad I was able to give some hope to other people. That there's some good stories out there.
Hi, Daddy.
Doctors say it will take at least 2 months for Titu to heal from the pneumonia, but he'll do it at home with his family by his side. For America This Week, I'm Victoria Sanchez.
Thanks for joining us for America This Week. United we stand. We'll continue to bring you this show in the coming weeks to make sure your questions are being answered and to bring you the latest in the fight against the virus. Remember, be safe and healthy this Holy Week. United we stand. We'll get through this together.
American strong, strength by one equals strength by all.